So patients want to know, what are the complications or side effects that anybody can encounter with the GAE procedure? So as in any treatment, any type of invasive procedure, even starting an IV, there's always going to be a risk for some kind of side effect or complication that can arise. And the GAE procedure is no different. The important thing is to understand the difference between a major complication and a minor complication, and to know how frequently it can happen for anything that you're going to get recommended as far as surgery or invasive procedure is concerned. The good news with the GAE procedure is that there is no major complication that's ever been reported. What I mean by a major complication is something that would result in you losing your leg, or needing to have a major surgery to fix the problem, or a major infection where you're in the hospital for several weeks. And even a major complication would be certain surgeries can cause death to happen. None of these have been ever reported with the genicular artery embolization procedure. Now, minor complications can arise. The most common is skin discoloration. About 20-30% of the patients, when this procedure is done, you can get a transient skin discoloration where the area that's treated, as we're kind of closing down the little blood vessels where the inflammation is located, sometimes that could be close to the surface of the skin, and that could cause a short-term discoloration of the skin, usually lasting about a week or so, and it just usually goes away on its own. The other issue is that we want to always tell patients about is this very, very small chance of a blood vessel injury where we start the IV, usually in the groin or at the bottom of the foot area where we start the IV, and you can have like a small bleeding complication which may require some kind of other procedure to fix. The frequency of something like this is still very, very rare. Maybe 1 out of a few thousand patients you can have some kind of injury where you have to do something else, like, go to surgery to get it fixed. It's very rare. Usually you get a little bit of blood that can swell underneath the skin in the site where we punctured, and that usually just goes away within a week or so. So overall, the procedure is extremely safe with very, very low, minimal to negligible side effect profile. In any event, as a patient, you should always be advocating for understanding what your risks are going to be. And every patient may be a little different. Depending on your underlying healthcare issues and your condition, your risk may be a little altered than somebody else. And this is why it's important to go talk to somebody. We're happy if you want to give us a call. We're happy to talk through your particular condition and what your risk profile would look like. Alternatively, feel free to make an appointment to come see one of us, where we can sit down and have a more thorough chat about your knee pain issues, whether you're going to be a good candidate for this procedure, and what your particular risk could be. So hopefully you found this information helpful, and we want to wish you good luck as far as your particular pain-related issue is concerned. Take care.